During this segment, we'll tell you just about everything you need to know about the colonoscopy exam, one of the most important routine procedures recommended for everyone. You'll learn about the reasons why and when you must put a colonoscopy exam on your list of priorities. We'll talk about the two most frequently used preparation methods for the exam, and you'll hear the details about what to expect during and after the procedure.
My name is Dr. Veloso. I'm a gastroenterologist practicing gastroenterology in the city of Miami for the last 30 years. I did my studies in the University of Zaragoza in Spain, and I did my training in internal medicine and gastroenterology in Pittsburgh.
Hi, my name is Dr. Alexander Veloso. I've been practicing medicine since 2005. I did my internal medicine residency training and gastroenterology fellowship at the University of Miami Jackson Memorial Hospital.
Did you know that a colonoscopy exam could save your life? Simply put, a colonoscopy is nothing more than an exploration of the rectum and the intestines. But this exam can detect a variety of medical conditions. Among them, polyps are the most common, some of which could be or could become cancerous. The exam can also detect diverticulitis and ulcers, among other conditions.
25% of people that have polyps, maybe half of them, the polyps are the type that they can grow and turn into a malignancy, into a tumor. It is a shame nowadays that colon cancer is still the fourth cancer in the population. It's still the number two cancer that kills people, when it's the only tumor that can be prevented through colonoscopy, which is the only prevention accepted.
Colonoscopy is primarily used as a screening tool for colon cancer. Colon cancer is one of the top 3 cancers worldwide, and it's one that we can prevent. Not only prevent, but at times we can even cure this cancer if we find it on time.
The colonoscopy is recommended for everyone at the age of 50, regardless of gender. At a younger age, if there is a family history of colon cancer or certain symptoms in the digestive system, such as irregularity or changes in your digestion, drastic weight loss, or rectal bleeding, among other symptoms. By far, the most critical aspect of a colonoscopy exam is the preparation that you must do before your procedure.
The colon is a hollow organ that is about 6 feet long. We're going to be with a very small TV camera looking at that 6 feet long tubing. So the patient has to have a very clean colon for us in order to see.
There are many prep medications or laxatives available. You'll have choices based on your preference, insurance coverage, or doctor's recommendation. During this segment, we'll explain the simple steps you must follow when using two of the most frequently used preparation methods. One is called Suprep. This method contains 2 small bottles of a laxative, which must be mixed with water.
The day before the test, you need to get prepped for the test.
There are 2 key components. Number 1 is the diet. From the moment you wake up to the moment you go to bed, it is essential you follow a clear liquid diet. Second component is the bowel prep.
Starting at 4 in the afternoon of the day prior to your procedure, pour one of the bottles into the plastic cup provided. Fill it with fresh water up to the 16-ounce line marked on the cup. Mix it well and drink it all. During the next hour, you must drink at least 32 more ounces of water or clear liquids. Repeat the exact same process with the second bottle of medication provided, starting at 8 o'clock that evening. Another preparation method that is widely used is commonly known as the gallon. For this method, you'll need to fill the container with fresh water up to the maximum liquid line and mix it well. Begin drinking the solution at 4 in the afternoon of the day prior to the procedure, accompanied by plenty of water or clear liquids. You must finish drinking the solution by 9 o'clock that evening. Regardless of the preparation method that you use, you may not drink or eat after midnight. As with most cases, the morning of the procedure, the worst is most likely over.
Good morning.
After a brief admission process, checkup, and preparation, your doctor and medical assistants will be available to discuss any concerns you may still have. The procedure usually takes 20 to 25 minutes, depending on whether any polyps are found.
The procedure itself should be painless. We basically give you a deep sedative when you fall asleep. When you wake up, you're in recovery.
You will need someone to drive you home, although you'll be fully alert after recovery. You may not drive due to the sedative that is administered during the procedure.
At the end, you're going to be sleeping for another 10-15 minutes, and then you're going to wake up. Most of the people wake up like nothing happened.
A few minutes later, you will meet with the doctor once again to briefly go over the results of the exam. Gastromed, committed to your health.